decongest prisons. Speaking at the Isiolo GK prison, the PS affirmed that there was a need to initiate a review of some cases for minor offences so that courts can release those convicted wrongfully and allow those serving short sentences for minor offences to do community service.
Tumetengeneza huu ukuta, nimeona tuna improve hii kitchen, tutaendelea ku-upgrade hizi wards zenyu to make sure mko na kila kitu ambacho mnafaa kuwa nacho, ndio mkiwa hapa hii kweni hii season ya kujitafakari. Sisi tutafacilitate hiyo. Tuna employ enough counselors ndio mpate kusaidika, na probation office iko tu pale. Probation officers tumeongezea the number of probation officers ndio waweze kuwa wanawatembelea na kutatua maswala yenu.
Judge atafanya review of the sentences, ataungana na probation, apate report yenu mzuri kutoka kwa probation officer ambaye pia anafanya kazi kama community service officer, and then ruhusu muende mfanye kazi ya nyumbani.
Maybe 5 years. Prisons are going to have the population if we continue employing probation officers. Sometimes prison officers on that is ni kama utapoteza kazi. Ukiwa kazini hautapoteza.
The harsh economic times, coupled with the recent flooding in parts of the country, are to blame for the sharp rise in the number of street families in major towns. According to the Street Families Rehabilitation Trust Fund, Nairobi, Kakamega, Eldoret, Kisumu and Nakuru are some of the hardest hit towns. This came as the fund launched the Street Families Policy that seeks to address challenges facing the families and ways of rescuing them from the streets. According to Caroline Towet, the CEO of the fund, the last census conducted in 2018 indicated that there were 46,000 families, with the numbers rising significantly to date.
A national census was carried out in the way back in 2018, and it indicates that at that time we had 46,000 street families. These are people who are composed of children, the elderly, and the youth. And the figures for children then were 15,000. That's in Nairobi alone, and in other major cities like Eldoret, Nakuru, Mombasa, Kakamega also we had quite a number. It is right now, due to the economic hard times, many people are flocking to the streets. Also the natural calamities like the recent floods affected people, and many of them drove to the street.
We want to bring together all the multi-stakeholders and ensure that they participate in the issues of ensuring that there is a reduction of street families within our city, within our towns. We have been told the major towns where we have a lot of street families. We have also come up with other policies which will also be used by families, by Kenyan families, to ensure that the family takes the center stage to ensure that their children don't go back to the streets.
This policy, what are we saying? It's going to say about all the street families, women over 18, so that we can help them. The government, they are the one who are giving the money to help these street families.
Over 100 women living with fistula are expected to benefit from free surgeries during a week-long medical camp at Thika Level 5 Hospital in Kiambu County. Kiambu County has partnered with the M-Pesa Foundation and other stakeholders to impact 1,000 women by the end of the year as it affirms its efforts to restore dignity in the community.
Yeah.
We are embarking on a very serious project where we are going to equip
all our hospitals with the necessary equipments that are required, including theaters. Right now, all our hospitals, we are making sure the new hospitals that we are building, that we are making sure that they have theater to take care of mothers, expectant mothers who are due for delivery. And when they get those complications, they are able to be attended immediately and cases of fistulas are averted.
If you're not able to access a health facility at the time you are pregnant, that is one of the reasons. That is one of the reasons. So it could well be, yes, in the rural areas, but the message that needs to go across, that when you are expecting a child, be able to go to antenatal and postnatal clinics. You can be observed, you can be checked, and if there's a challenge, that can be arrested immediately.
Construction of 220 housing units at Makenji village in Kandara constituency, Murang'a County, has been lauded as a life-changing program, transforming the lives of locals at the bottom of the pyramid by creating jobs, providing decent housing, and reducing agricultural land fragmentation. Locals in the area are calling on the government to consider setting up similar projects for enhanced transformation.
Construction of 220 housing units at Makenji village in Kandara constituency, Murang'a County, has been lauded as the life-changing program that is transforming locals at the bottom of the pyramid by creating jobs, providing decent housing, and reducing agricultural land fragmentation. Locals are calling on the government to consider starting up similar projects in the area for enhanced transformation. The first phase of the affordable housing project, which is 30% complete, is said to not only turning around the economy of the hit hard or sleepy village, but has also, according to locals, significantly reduced crime activities in the area.
We started this project in November 2023, and as now, according to the time which has elapsed or has been completed, is at 58%, but the actual work done, the status of completion of the project is at 30%.
In Murang'a alone, the government plans to construct 10,000 affordable housing units by 2027. Elsewhere, the affordable housing project in Kirinyaga County has turned out to be a rehabilitation center for most youths working there and who had plunged into drugs and substance abuse.
Wakikuja hapo wanasaidika, wanapata kazi na wana mambo ya kuenda kuiba, kufanya mambo mingi huko, hakuna kula mila, kuna kunywa pombe.
Kufikia saa hii tumefika 65% ya time yenye tulipoa. Tumepoa kumalizia mpaka September. By September 11 tunafaa kuwa tumemalizia.
Kennedy Murioki, one of the casual laborers at the project, says that before he had gotten to desperation stage and became an alcoholic.
Hii project kabla haijaanziwa mimi nilikuwa mlevi, miraa, sigara, bangi, lakini saa hii ilipoanzishwa mimi niko sawa. Hata hizo vitu situmiangi sasa.
The project has had a great impact not only on the economy of the area, but also in rehabilitating the youths and moving their mindset from alcohol and substance abuse. Martin Opio, K24 TV, Nairobi.
That report by Martin Opio brings us to a close on K24 Newscut. Many thanks for watching. For more information, log on to our website at www.k24tv.co.ke. Evelyn Ongui has been the sign language interpreter. My name is Michelle Ngele Odhiambo. Good afternoon. Do enjoy the rest of your view.